Good morning. Good morning. Can you please take your seats? We are just about to start. Ladies and gentlemen, esteemed ministers and honored guests, welcome to today's session on resilient food systems. As we gather here in Lyon, France, we are reminded of the critical role food systems play in shaping our collective future. And we do this in the context of One Health. The One Health approach recognizes the interconnectedness of human, animal, environmental health, and our food system are key to this equation. Recent pandemics, including COVID-19, Mpox, Ebola, swine flu, MERS, have highlighted the vulnerability of our food systems. The current climate crisis even further exacerbates the challenges that we all face. Today, we'll explore ways to build resilience, promote sustainability, and ensure equitable access to nutrition food for all. Our discussion will inform strategies to transform food systems, leveraging science, innovation, and collaboration to achieve the Sustainable Development Goals. On this, I would like to acknowledge and thank the leadership from France and the co-organization of this summit by the Republic of Ghana for bringing us here. We can talk, but leadership matters. We are here to ensure that we build on the leadership from these two great nations to become leaders as we talk about One Health. It gives me great pleasure to invite the keynote speakers. But before I do that, I want to share with you that our section have 4 segments: the opening speeches, the panel discussions, and other panel discussion on actions that we must take and solutions. And I will provide the closing remarks, really not to paraphrase what we've heard, but to bring some of the perspective. I come to you from the International Livestock Research Institute, part of the CGIR. At the end, we'll show what we have been doing and our commitment to support this movement, ensuring that we are in this. We want to be the custodian of our planet, of our food systems. We want to ensure that future generations will benefit from the leadership and some innovations that we can generate now. Let me use this distinguished guest to invite Eleanor Carwa, Minister Delegate to the Minister of Europe and Foreign Affairs, who is responsible for Francophonie, international partnership, and French nationals abroad. Over to you, Minister.
Thank you very much, President. Again, a point of housekeeping. Do you all have headphones? I apologize. I have to speak French. It's mandatory when you have Francophonie in your title. Yes, okay, great. So if you don't have headphones, please let us know. We'll provide you with some. Okay. Mesdames et messieurs les ministres, Excellences, Mesdames et messieurs les représentants d'organisations internationales, de banques de développement, chers partenaires de la société civile, du secteur privé, des philanthropies, de la recherche, mesdames et messieurs en vos grades et qualités. Oui, c'est encore moi. Si vous étiez dans l'auditorium, vous avez déjà entendu tout ce que j'avais à dire. Mais il se trouve que nous allons parler d'un sujet qui me tient vraiment éminemment à cœur et je pense qu'à vous aussi. Parce que s'il existe un domaine emblématique des interactions entre santé humaine, animale et environnement, c'est bien l'alimentation. Et dans cette capitale de la gastronomie, il fallait qu'on commence par ça. C'est ce qu'on appelle, dans un vocabulaire technique un peu désincarné, les systèmes alimentaires. Et pourtant, ces fameux systèmes alimentaires représentent ce qu'il y a de plus concret, ce qu'il y a de plus vital dans notre rapport à l'environnement. Il fallait donc un moment important de ce sommet pour y revenir. Pour introduire nos discussions, je vais aborder, disons un peu en rafale pour aller vite, les grands aspects qui pourront être au cœur de nos réflexions ce matin. En faisant d'abord une remarque sur l'acuité renouvelée de la question alimentaire dans un monde qui n'est toujours pas celui de l'abondance espérée, mais où on a des raisons d'être optimiste. J'y reviendrai. Car un fait majeur, commençons par cela, c'est quand même qu'il y a des conflits partout dans le monde et que dans leur sillage, le spectre de la pénurie plane, la pénurie énergétique bien sûr, mais aussi la pénurie d'engrais agricoles et parfois, même souvent malheureusement, la pénurie alimentaire. Et toujours au-dessus de nos têtes, cette épée de Damoclès qui montre chaque jour ses conséquences violentes, le dérèglement climatique. Et disons-le, répétons-le, à l'heure où certains contestent l'existence de ce dérèglement. Ces crises nous renvoient à la fragilité de nos systèmes de production alimentaire et agricole. Il nous faut penser et produire différemment, en quantités qui sont adaptées. C'est pour ça que je vous dis, on a quand même des raisons d'être optimiste parce que vous le faites déjà, vous soutenez des politiques dans ce sens déjà. Et je pense que c'est aussi la raison d'être de cette discussion, c'est de mettre en avant ce qui marche et ce dont nous pouvons nous inspirer. En attendant les constats, c'est qu'au-delà des pénuries alimentaires, de la malnutrition, y compris de la malnutrition sévère, on a aussi l'obésité qui affecte près de 800 millions de personnes dans le monde. Et de l'autre côté, la sous-nutrition, 733 millions de personnes. 800 millions, 733 millions de personnes. Un paradoxe insupportable, mais en réalité assez clair lorsque l'on s'en remet aux chiffres. Le fonctionnement de nos systèmes alimentaires n'est pas durable, n'est pas soutenable, que ce soit du point de vue de l'utilisation des ressources naturelles ou de ce qui nous occupe aujourd'hui, la santé humaine. Dans une perspective extrême, l'aliment ultra transformé que l'on consomme en Europe peut avoir été produit à base de viande asiatique et ces animaux nourris à la faveur d'actes de déforestation, par exemple en Amérique latine. Là, on est vraiment dans le cas d'exemple de ce qui ne marche pas, d'à quel point ces interconnexions peuvent s'avérer finalement néfastes et ce cercle vicieux. Il en va de même pour la contamination chimique des aliments au cadmium, au PFAS et j'en passe. Y compris dans des pays développés, une alimentation sûre et saine n'est pas garantie. Et à l'autre bout de la chaîne de valeur, une agriculture... Je crois qu'il y a de la concurrence là-bas. Bon, en tout cas. Et à l'autre bout de la chaîne de valeur, une agriculture extractiviste qui apporte des revenus immédiats à court terme et à plus long terme, des sols qui s'épuisent, la diversité du vivant qui disparaît, le risque d'insécurité alimentaire qui n'est pas parti. Bref, dans ce tableau un peu noir de nos réflexions d'aujourd'hui, nous aborderons les points positifs, ce sur quoi nous pouvons avancer, par exemple l'agroécologie, une approche qui vise à inverser la tendance, à créer justement un cercle vertueux. Quel que soit le nom que l'on appose sur la démarche, il est urgent de construire des systèmes alimentaires qui soient véritablement résilients. La France le fait déjà au niveau national et nous souhaitons susciter cette dynamique et nous inspirer d'autres exemples qui fonctionnent. Je pense à l'adoption de la nouvelle stratégie pour l'alimentation, la nutrition et le climat qui a fait l'objet de très longs débats. Je pense aussi à l'action que nous avons auprès des enfants, par exemple à la protection auprès du marketing alimentaire très offensif parfois, à la mise en place d'une alimentation équilibrée dans les cantines scolaires. Et nous avons aussi cette coalition sur les cantines scolaires qui montre bien que c'est une action à l'international. Je pense aussi à nos hôpitaux, des établissements médico-sociaux qui doivent désormais respecter des cadres nutritionnels très exigeants. Ces mesures opérationnelles, nous réfléchissons à les porter plus loin, car il s'agit de défis globaux. Ça ne sert à rien de réfléchir dans les cadres d'un État. Nous y travaillons dans les instances multilatérales, avec par exemple les conventions de Rio, les Food System Summit des Nations Unies et son processus de suivi. Et nous avons à cœur d'accompagner l'opérationnalisation sur le terrain avec nos partenaires. Il nous faut faire connaître, faire adopter cette approche One Health et c'est la raison de ce sommet, la raison pour laquelle nous avons souhaité l'organiser. Hier soir, il y avait un événement, je ne sais pas si vous avez pu assister, qui faisait le bilan du sommet Nutrition for Growth que nous avions organisé à la suite des Jeux Olympiques et qui s'était tenu il y a un an pile à Paris. Nous avons pu évaluer les progrès des premiers engagements pris. Et je vais vous dire, moi personnellement, c'est ce que je préfère dans ce type de réunion. On a des discussions, on a des tables rondes, c'est évidemment pertinent et intéressant. Ce qui est important, c'est de se rendre compte que d'un sommet l'autre, on arrive à avancer, on fait des progrès et ces progrès touchent évidemment des vies. Donc c'est encourageant, je vous disais que j'allais être optimiste, je vous l'avais promis, de voir que cet élan persiste, il se multiplie et que grâce à vous, il se diffuse aussi dans de nombreuses autres géographies. Mais nous ne pouvons pas, évidemment, en rester là. Il nous faut accélérer l'opérationnalisation de cette approche une seule santé. Et c'est dans cette perspective que la France est engagée, dès 2026, à soutenir les premiers projets pilotes qui adoptent cette approche pour lutter contre la malnutrition infantile, s'attaquer aux causes sanitaires, animales et environnementales de la malnutrition. Un autre défi, je vous promets, je ne serai pas très longue, c'est les zoonoses, ces maladies, par exemple la dermatose nodulaire contagieuse, qui témoignent de notre vulnérabilité vis-à-vis de maladies transfrontalières. Leurs conséquences ont été extrêmement dures pour nos agricultures et nos agriculteurs. D'ailleurs, ça a eu des conséquences, y compris dans nos débats, dans le débat politique, par ces agriculteurs et agricultrices qui sont passionnés par leur métier et qui ont dû subir les conséquences de ce fléau, y compris des conséquences très directes sur leurs élevages. Et nous devons être capables de surveiller au plus près du terrain l'apparition de ces maladies contagieuses pour les prévenir et pour ne pas en arriver à des situations extrêmes. Ça doit être le cas au niveau des animaux domestiques, évidemment, mais aussi de la faune sauvage, pour donner l'alerte à temps et prendre les mesures nécessaires en termes de prévention. Pour la dermatose nodulaire, comme pour d'autres maladies, on notera combien les réactions observées sur les réseaux sociaux témoignent d'un niveau de défiance alarmant vis-à-vis de la science et des pouvoirs publics. Et ça, j'aimerais insister sur cela, mesdames et messieurs, parce que nous y sommes tous confrontés. En France, nous souhaitons mener des politiques publiques qui soient basées sur la science. Et on voit bien à quel point, parfois, on oppose science et croyance, science et opinion, science et finalement défiance. Nous devons être capables de mieux appliquer notre action et les mesures qui sont prises, par exemple, la vaccination, l'utilisation sobre des antibiotiques pour éviter les résistances. Ce sont des sujets qui seront traités dans le cadre du One Health. Mais voilà, je ne souhaite pas être plus longue parce que vous avez énormément de sujets à aborder. Je voulais juste rappeler que c'était ça l'enjeu clé pour l'approche une seule santé. Parler à tout le monde, avec tout le monde et pour tout le monde, pour tous nos concitoyens. Ce colloque, aujourd'hui, ce n'est pas un colloque de scientifiques. Moi-même, je ne comprends pas la moitié des mots scientifiques qui sont dans mes discours. Ce colloque aujourd'hui, c'est un colloque pour les citoyens. C'est un colloque pour ceux qui nous écoutent, pour ceux qui aujourd'hui doutent, pour ceux qui aujourd'hui pensent que la science est une affaire de croyance, pour ceux qui se demandent si nous adoptons les bonnes politiques publiques. Ce colloque, il faut l'amener au plus près des citoyens, parce que notre santé en dépend, la santé de nos enfants en dépend, de nos parents, de nos sociétés. Toutes ces santé sont interconnectées. Alors travaillons à l'échelle des territoires sur la coordination des acteurs et des secteurs. Travaillons pour articuler de manière intelligente les politiques publiques en tenant compte des attendus et des réalités locales. Moi, je n'ai aucun doute que vos discussions seront à la fois très savantes, mais aussi très pertinentes, qu'elles seront très fructueuses. Et je serai personnellement très attentive aux recommandations qui seront faites dans ces nombreux panels. Je compte sur chacune et chacun d'entre vous pour en faire autant. Encore une fois, bienvenue au sommet One Health et merci beaucoup de votre participation.
Merci beaucoup, Madame Karoua. Nous avons entendu votre optimisme. Nous avons aussi entendu l'urgence qui nous interpelle. Et finalement, en tant que scientifiques, nous avons compris votre engagement à faire en sorte que la recherche, les résultats scientifiques dirigent les politiques publiques. Donc, merci beaucoup. Ladies and gentlemen, give me the opportunity to introduce Madame Ama from the Africa Union. She's Commissioner for Health, Humanitarian Affairs and Social Development. Thank you so much. Please come to stage.
Thank you very much, and good morning to you all. Before I delve into my statement, I would like to take this opportunity to, on behalf of the chairperson of the African Union Commission, express our sincere appreciation to the government of France, as well as the government of Ghana, for organizing this event, which is very important to our very existence as human beings. Minister delegates to the Minister for Europe and Foreign Affairs responsible for Francophonie, international partnerships, and French nationals abroad, Ms. Eleanor Creel, honorable ministers, distinguished delegates, ladies and gentlemen. It is an honor and a privilege for me to participate in this important event and to deliver a statement on behalf of the African Union Commission as we deliberate on our common goal, leveraging One Health for sustainable food systems transformation. Ending hunger and malnutrition lies at the very heart of Agenda 2063, the Africa we want. Our continental vision for an integrated, prosperous, and peaceful Africa where our people thrive in good health and are free from the burdens of malnutrition in all its forms. Yet today, this aspiration continues to face serious challenges. The lingering effects of COVID-19 pandemic, rising food prices, climate variability, economic pressures, and conflicts have intensified food insecurity across our continent. Millions of Africans remain vulnerable to hunger and malnutrition. Globally, food systems are failing on multiple fronts. While sufficient calories are produced, nearly 1 in 3 people suffers from some form of malnutrition, whether undernutrition, micronutrient deficiency, hidden hunger, or obesity-related disease. Food production is also a major driver of biodiversity loss, deforestation, and greenhouse gas emissions. At the same time, it creates conditions for pathogens to move between animals, humans, and ecosystems. Fragmented policies and siloed institutions mean that human health, animal health, and environmental protection are often managed separately, and the cost of this fragmentation is increasingly visible. Today, as we speak, over 735 million people globally face food insecurity, including about 320 million in Africa. Nearly 60 million African children under 5 suffer from stunting, while 12 million suffer from wasting. Poor diets contribute to nearly 20% of premature mortality worldwide, and 3 billion people cannot afford a healthy diet. And over 75% of emerging infectious diseases in humans originate in animals, with climate change further amplifying these risks. Food systems sit at the intersection of these challenges. They can be a source of risk through unsafe practices, antimicrobial misuse, and environmental degradation. But they can also be a powerful source of solutions. If we address these challenges in isolation, we will fall short. But by embracing the One Health approach, we can transform food systems into engines of resilience, equity, and sustainability. One Health is often associated with pandemic preparedness, but it is far more than that. It is a practical framework for designing food systems that protect human health, animal health, and the environment simultaneously. Across Africa, we already see promising examples, and I'm going to cite 2 here. In Rwanda, livestock vaccination campaigns have reduced brucellosis in both cattle and humans, improving milk safety and farmer livelihoods. And in Ethiopia, a national One Health task force is coordinating ministries of health, agriculture, and environment to address zoonotic diseases and food safety challenges. Across regions, improved antimicrobial stewardship in livestock production, agroecological farming practices, and integrated surveillance systems are strengthening resilience while protecting public health. Recognizing these challenges is only the first step. What matters most is the action we take going forward. First, We must strengthen governance and policy coherence. Ministries and agencies must move beyond siloed approaches toward integrated food systems, strategies, and shared accountability. Second, we must transform production and supply chains by improving animal health practices, reducing unnecessary antibiotic use, restoring degraded landscapes, and strengthening value chains for nutritious and sustainable foods. Third, we must strengthen surveillance systems and community engagement, ensuring early detection and coordinated responses across humans, animals, and ecosystems. In this regard, the African Union Commission continues to support member states through key continental frameworks, which include the Africa Regional Nutrition Strategy, which is from 2026 to 2035, the Multi-Sectorial Nutrition Policy Framework for Africa, and the funding target for nutrition investment in Africa. Distinguished participants, with the partnerships represented in this room today, I firmly believe that we can reshape food systems into engines of health, resilience, and shared prosperity. Let us commit to 3 practical actions. The first one is convene cross-sector leadership across health, agriculture, and environmental institutions. Second, pilot integrated food system interventions that measure impacts across human, animal, and environmental indicators. And third, align financing with measurable co-benefits that deliver health, nutrition, and environmental outcomes simultaneously. If we act together, we can build a healthier and more nourished Africa, and for that matter, global society. One where food systems sustain livelihoods, protect ecosystems, and improve the well-being of our people. Because safeguarding one health ultimately means safeguarding our shared future. I thank you.
Thank you, Madam Commissioner. Thanks for those kind words and the African perspective, and more importantly, some examples, what's happening on the ground. So, ladies and gentlemen, we need to rearrange our schedule a little bit to accommodate a little conflict. It gives me pleasure to invite the chair of the UN Nutrition, Madam Najat Mokhtar, to offer her keynote. Thank you.
Thank you. Thank you for accommodating me. And good morning to all of you, Excellencies, ladies and gentlemen. It's a really pleasure to be here with you all and to discuss how the One Health approach is central to transforming food systems and delivering healthy diets and good nutrition for all. Speaking here in my capacity as the chair of the UN Nutrition, the United Nations coordination mechanism that brings together 15 UN entities whose work contribute to integrated nutrition across health, agriculture, environment, education, and other sectors in order to tackle malnutrition in all its forms. At the outset, allow me to thank France for its stellar commitment to advancing the One Health agenda, not only through this important summit, but also, of course, through the leadership of France of the very successful Nutrition for Growth Summit in 2025. Ladies and gentlemen, let's think or imagine a small farming community where the health workers are concerned about the health of children, that they are undernourished because they are lacking diverse and nutritious diets. They need to grow, learn, and thrive. The health workers is also concerned and overstretched, noticing resistance to antibiotics. And at the same time, the agricultural worker reporting soil fertility being declining, crop production decreasing because of the vulnerability to climate and pest pressures, and water, the resources that once were abundant are becoming more and more rare and polluted. These challenges might appear disconnected, but in reality, they are part of the same story. They are deeply interconnected symptoms of food system that are failing both the people and the planet. But it is important to highlight that this is not only a problem of small rural community. In fact, the interconnection between healthy environment, healthy planet and animals, healthy diet, and healthy people affects us all. And indeed, malnutrition in its different forms affects every country in the world, in both everyone's problem and everyone's responsibility. According to the 2025 according to the 2025 State of Food Security and Nutrition in the World, 2.6 billion people, nearly 1/3 of the global population, could not afford a healthy diet in 2024. These challenges coexist with rising obesity driven by many of the same underlying factors, and we heard Her Excellency the Minister emphasizing that as well. So since 1990, adult obesity worldwide has more than doubled. And in 2025, the global prevalence of obesity among school-aged children and adolescents exceeded underweight for the first time. For too long, we have tried to address these challenges in silos, and we focused on producing more food without asking what kind of food we are producing and at what cost. We delivered micronutrients through pills and powders without questioning why we often fail to provide them naturally through balanced, healthy diet. Meanwhile, the food environment has become impoverished, dominated by highly processed foods, high in salt, sugar, and unhealthy fat. This is precisely why the One Health approach is critical. So where do we go from here then, knowing the magnitude of the problem? So instead of asking how do we produce more food, let's ask on how do we produce nutritious food for healthy diet, sustainably, safely, and equitably. Instead of reacting to crises, let's try to prevent them by addressing risks in coordinated manner at their source in communities, farms, market, or ecosystems. We must also bring everyone together, health workers, farmers, veterinarians, environmental experts, policymakers, and above all, women, empowering them in agriculture and giving them access to land and to decision-making. Youth, giving them opportunities and engaging them to bring innovation, energy, and long-term resilience for sustainable food system. The United Nations is supporting One Health implementation in countries not only through the contribution of the various specialized agencies, but above all through strong inter-agencies collaboration to align agendas towards a common objective for better nutrition for all. Of particular note, the quadripartite partnership brings together FAO, WHO, UNEP, and the World Organization for Animal Health, ensuring the UN works together, hands in hands with countries to address risks at the human-animal environment interface in a coordinated manner. Another immediate opportunity to continue this conversation lies ahead at the Rome Nutrition Week in next May, 2026, where governments, the UN, and partners will continue linking our work across sectors to ensure good nutrition for all. We hope many of you will come and will continue to engage and align agendas. The all too familiar story, ladies and gentlemen, that I began with, it's not inevitable. A One Health approach challenges us to design solutions that are inclusive and ensure access to healthy diets from sustainable food system and good nutrition for all. That is the future UN Nutrition is committed to, and the future we should all be working towards. I thank you. Thank you.
Thank you. Thank you, Madam Chair. Good nutrition for all. Let's not forget children. The first 1,000 days on earth, we need to supply nutritious food for our children. Otherwise, they'll be on a completely different path. Thanks for your leadership. Thanks for your agency for helping us to achieve that. So to finish this segment, we want to move now to the scientific framing. We are joined today by Olanike Adeyemo from the University of Ibadan in Nigeria. I should also say that she was part of the speakers yesterday during the science segment of this. Welcome on stage.
Yeah, I'm a bit tall, so I hope. So this is the scientific framing, so I would like us to please pay close attention to this. Your Excellencies, distinguished ladies and gentlemen, good morning. I'll be talking about what are the different facets of One Health approach in food systems. We are looking at the key points, bottlenecks, and the opportunities that we have. To start out, I think one of the things we have to realize, like we've heard, there's enough evidence to show that One Health is required. What we need now is One Food, One Health operationalization. That is the overarching, that is what we need to take away with us. And what does that look like? It's mainstreaming the interconnectedness of ecosystems, plants, animals, and when I say animals, wildlife are inclusive, and human health. From research, conceptualization, food production, and along its value chain, in practice, policy, enactment and implementation, and the M&E framework as well. And what I'm trying to say is that we need to put action to the recognition that food system is a driver of health across all domains. Action is also required if we're looking at where actions are required. I will only mention a few. Food safety, those are the things we're dealing with, antimicrobial resistance, and zoonosis, of course, which is a big one. So understanding and identifying, preventing, mitigating risks of pathogen transfer from animals and wildlife, inclusive to humans, I have a need to keep saying that, as well as unhealthy input into production, ensuring not only nutrition but safety at production and along the value chain. The other thing is environmental sustainability. That's one of the facets as well. And that will look like preventing and mitigating environmental contamination from food production. That is when it's sustainable. Pesticides, everyone is talking about chemicals, fertilizers, sewage in water. What goes around comes around. And then one of the things that we always ignore is the socioeconomic and behavioral factors. And that will look like equitable food systems, protecting smallholder farmers, identify economic drivers and tackling barriers of local markets, which is more concerning in low, medium income countries. And then ongoing engagement on consumer preferences and cultural norms. Everyone is getting westernized. Maybe we need to go back to the way our fathers used to eat, and that is what will make us healthy. So when you talk about the key considerations or the key aspects, that is the why and the how. And the why will be the incontrovertible, which everyone has been talking about, interdependency of ecosystems, the plants, animal, human health. They are all linked. And so that is the why. And then how? Holistic, all-inclusive surveillance instead of the fragmentation we now have. Everyone is busy doing their own thing. The other thing is collaborative governance to break down disciplinary and operational silos. So even when we break down the disciplinary silos in our mind, operationally, they are still siloed. And so we need to work on that. Prevention as a strategy, long-term, proactive, preventive strategies, instead of reacting to crises like we all did during COVID. And then evidence-based management of incidences. How do we manage, even when we have crisis, what do we do? Sorry, my system is misbehaving, as systems I want to do. So I think I talked about this. So in concluding, okay, no, not concluding yet. So it brought me conclusion. Bottlenecks, what are we talking about when you look at the bottlenecks? The overarching bottleneck will be the coordination and governance across environment, animal, human sector. From training to practice to policy framework. Do we even have the adequate capacity, workforce capacity to implement One Health if we want to do it effectively? Lack of resources, funding, and most of the time, the will. We are all in this room. Are we willing? We are able, but are we willing? Data sharing and or integration, those will be a bottleneck, and complexity of navigating traditional markets and other institutionalized structures. So what are the opportunities that we have? Leveraging technology to address some challenges, e.g. data sharing, using biosurveillance tools, intentionally supporting local markets and value chains, incentivizing food safety, where you can close down local markets, especially in low-income countries. Then digital influence, how do we change the mindset of people about what they consume and their behavior? In conclusion now I can conclude. Implementing the One Health approach towards food system transformation requires one, holistic multi-sectoral strategy across human health, animal health, and environmental sustainability domains. Investing in infrastructure and institutional adaptation for synergy, and strengthening data sharing or integration across all sectors, and then fostering community engagement to tailor solutions to local contexts. It has to be contextualized. It will vary from country to country. I thank you most sincerely for your attention.
Thank you so much, Madam Adeyemo. Very clear, our food. How are we producing the food? Where are we producing? How are we taking it to people safely to eat? Secondly, the ecosystems, our planet, the environment, what are the boundaries? And finally, the action. You mentioned we take action and we monitor. And I hope when we come back to these events, we take stock where we've been, what's happening, what action we've taken, and how we are improving lives in the communities. So that was the first segment of our session this morning. And I want to turn to public policies. We have leaders in the room. Let me introduce the Minister of Health, Republic of Ghana, to come on stage. Mr. Kwabena Minta, thank you, sir. I also want to invite, Mr. D. Tina from the Cambodia Ministry of Agriculture, Forestry and Fisheries. Thank you. Thank you very much. Last but not least, Mr. Neophytus, Minister of Health of Cyprus. Thank you, sir. You're welcome. Please settle down, put your earpiece if needed. Let me start with the Republic of Ghana. Honorable Minister, can you please share with us where you see the greatest remaining challenges in your country? We're aware of some of the progresses and advances that have gone on in the Republic of Ghana, and we're very honored that you're co-chairing this summit. And can you also mention some projects and initiatives to highlight that progress, focusing on Ghana, but lessons that we can learn and take to other places? Thank you, sir. Over to you.
Thank you very much, colleagues. Let me use this opportunity to thank the organizers of this program, of which Ghana is part, for bringing this very important issue to the fore. Food insecurity is a major problem in the world, and about 2.3 billion people in the world are food insecure. About 2.6 billion can also not have access to healthy diet. And it is important for us to note that getting access to food is different from getting access to healthy food. And that must be made clear. But the worsening aspect, the troubling aspect, is the fact that it is even projected that about 60% of the people in the world who will be facing hunger will be coming from Africa by 2030, which Ghana is no exception. If you come to Ghana, we face triple burden of malnutrition. The overweight with the associated NCDs, the undernutrition, which results in stunted growth, and the macronutrient deficiencies. And so, even if we get access to food, the safety of the food is also as important as getting access to the food itself. We all know that the safety of food is a public health concern. How the food is handled, how the food is even processed, how the food is marketed. If not well handled, it could lead to foodborne diseases. And this comes with its associated costs. Some even lose their lives. The remaining challenges, as we all know, are not one sector problem. It is multi-sectorial, and there's a need for that integrated effort to tackle those challenges. Number one, we all know the climate and environmental conditions which affect, one, the production of the food itself and even the quality of food. And then, two, there are a lot of people in the world who also cannot afford food due to food inflation. And then the third one is the environment itself, where the food are processed, handled, has some kind of negative impact on the food at the end of the day. As I have already indicated, it could lead to, foodborne diseases. And so there is the need for all of us to come together and have that integrated approach to be able to solve these challenges. We've mentioned the climate, we've mentioned the environment, we've mentioned all these sectors do not sit in only one sector. And so I may want to share with you some of the approaches we are taking as far as Ghana is concerned. There is that deliberate effort to increase production in food, and that program is called Feed Ghana program. We are aiming at making food available, creating jobs, and reducing food dependency in Ghana. And then aligning the kind of food we produce with the kind of nutrition we also need as a country. Improving on the food systems, and then there is also the need for us to come out with clear policies, which we are doing at the moment. Policies like the National Nutrient Profile Systems, where if you take every package or pack of food, you will have the detail of the labeling of the nutrients on the pack so that it will inform the choice of the consumer. And again, we are also encouraging restrictions on marketing unhealthy foods, especially to children. And these must be policy. Again, we are looking at establishing a procurement procedure for procuring foods and systems in schools, hospitals, and government institutions. We are also encouraging fiscal policies, tax and incentives to be able to guide and influence production of food and even influence what kind of food people also buy. The National Food Safety Regulation Framework, which also seeks to bring other sectors on board. For example, the FDA, which sits with the Ministry of Health, and the Ghana Standard Authority, which also sits with another ministry. And so if we talk about One Health approach, it's, for me, the most important aspect is the political will to be able to implement all these policies. We've had all these challenges, we've had all these solutions over time. But then The big question is whether or not we have that political will to start, one, rolling out the policies, and even after the drafting or coming out with the policies, whether or not we have the will to implement those policies. And practically, I'm a member of parliament. This is my 4th term in Ghana's parliament. You realize that many a times when regulations come, the regulations are with respect to the sectors. So Ministry of Health will bring a regulation, and that is with respect to Ministry of Health. Ministry of Agric will bring a regulation that would respect to Ministry of Agric. But there should be that effort to bring a universal regulation where every sector sees itself in that same regulation. And that, for me, will cement the issue of fragmentation. Thank you.
Thank you so much. We've noted multiple sectors coming together for solutions, but also on policies. One important thing that I really want to stress, which is also connected to something that happened in France here a couple of years ago, school meals program. When you provide meals to schools, I think it's shown globally that we drive impact, we solve some of the issues at the root. And finally, policies and political will. Really thank you for that. Let me turn to Minister D. We know that there is a lot of progress in Cambodia, but I think good fortune or bad fortune from the avian flu really push you to bring some innovations that have helped you. And then we are here to hear from you and how we could use some of those examples to have impact in other parts of the world. Thank you, sir.
Bonjour tout le monde. Tout d'abord, en tant que pays francophone, je tiens à m'exprimer au début en français, mais peut-être plus tard en anglais pour que tout le monde puisse comprendre. Je remercie le co-président de ce sommet, la France et le Ghana, pour organiser ce sommet très important qui permet évidemment de prendre conscience de ce qui se passe dans le monde et surtout de pouvoir combattre ensemble ce problème de santé publique qui est lié à notre système de production. Et je vous remercie aussi d'inviter le Cambodge en tant que petit pays qui est en train de sortir du pays des moins avancés, mais qui a fait beaucoup d'efforts dans ce qui est le développement du côté sécurité alimentaire. On est un pays très petit, mais on est très déterminé dans notre approche One Health, santé, la seule santé. In English, to your question, actually, we have to come back to what Cambodia was coming from. Actually, we only achieved our peace from the civil war in 1998, and the avian crisis came somewhere around 2004, and that was very new for us, and we has been hit fully. It's fully impacted by this crisis. We start to, learn the new approach on how to deal with crisis, such a kind that cross species from animal to human. In this case, from the poultry to human. We have to call like 1 million poultry by the time, and when we are in a starved country by the time, 1 million poultry is a lot. It's very big. But that's what we have to do, and we manage this crisis. Of course, around 100 people was affected, and 58, if I remember well, was victim of this avian flu. But after that, we make our effort to really take the approach of One Health and work with a lot of partners, especially international institutions, big institutions like World Health Organization and also the Animal World Health Organization. And the partners as France, World Bank, and we managed to have what we are today. That's mean we successfully overcome the problem of food security. But again, you know, food security is a sustainable problem. It's not a sustainable solution. It's a sustainable problem. We have to deal with it all the time. We have to be fully careful on this. What proof is that when we come through many crises like the COVID-19 and the war that started from Ukraine-Russia war, the impact on food in our country is very least. But we are impacted, but very least. The way we manage it is that if you want to have the share opinion on that, actually it's 4 key things. One is awareness. Actually, the avian crisis in 2004 was a big wake-up call. That's why when it's come to COVID-19, Cambodia is one of the countries that managed one of the most successful in navigating across this crisis. So awareness is very important. And then political will. Of course, we have the same issues as any other country. We have to have this political will to combat this without thinking of the immediate profit, but a long-term one. This is very important, political will. After that, coordination. Because, you know, when we talk about these issues, it's across sector, across ministries, across institutions, and we have to work together. In Cambodia, our task force, we have a Ministry of Health, of course, but Ministry of Agriculture is one of the main partners to Ministry of Health on this One Health approach. And also Ministry of Environment, because the viruses and the wildlife, the bird, they flew without visa. They don't need any certificate when they cross the border, and they bring with them many things we don't know. But when sign happen, let's say that we find somewhere, and the ranger finds somewhere that the bird start to die, and then we have to go there, take the sample, doing the test, confirm what it is really, and take the measure needed. So from the wildlife, from the farm, in the farm we are very cautious. We have our like a veterinarian in the village that are very aware of that and very quick in reacting when there are signs that it is possible to have infection. And from the central, we go there and we take the sample and we test again if there is any sign of epidemic. Then we start the measure, appropriate measure according to the extent of the problem we found. So coordination is very important. And last but not least is the participation. Actually, it's a world problem. It's not just Cambodian problem, because one is happened, and when it goes cross borders, it can happen to anyone else. So the problem of that is the cost, actually. We have to see that the cost is very important, and if we want everybody to participate in this approach, costs need to be shared, actually. And we don't have to see it as a cost. Actually, it's an investment, because if we don't pay for this approach, then the consequence will be huge, like we see with the COVID-19. And I think that these 4 lessons is something that Cambodia wants to share. Of course, we are still experimenting a lot of things together, but we hope that this experience can, share with our partners from across the world, Africa, Europe, and if we have another better approach, then we can adopt it together with a good political will. Thank you very much.
Thank you, Minister D. We noted you framing the issue around public health. I think that's really important. And bringing different ministries to look into that. We appreciate that. Secondly, it's a food security issue. Partnership, as you've mentioned, to help drive your One Health approach, which is about coordination, is not a cost, it is an investment. I think investment in our people, investment in our food system, that must be resilient, and also investment on the environment. Thank you for sharing those important points. Let me now turn to Minister Neophytus to really bring the Cyprus perspective. Over to you, Minister.
Thank you very much. Let me start by thanking the French organizers for convening this excellent meeting and essential discussion within the One Health framework. Let me thank the previous speakers, Eleanor, Ama, Najat, Olanike, and of course, the two friends that share the stage with me for the inspiring positions as far as their countries are concerned. Let me say that sustainable food systems are not and should never be discussed as merely policy goals. We know that they affect everyday lives. They shape what our families put on their table, how our farmers make a living, and how we protect the environment for future generations. So our ambition, if I may say, is simple, that we ensure that everyone has access to food that is safe, nutritious, that is affordable, and of course that is produced in a way that respects both people and the planet, without at the same time compromising the ability of future generations to meet their own needs. So in Cyprus, we, being member of the European Union, we align our policies with the European Union initiatives, such as Farm to Fork strategy, the EU Safeguards Plan, the Beating Cancer Plan, and the EU One Health framework. That has a very important or heavy emphasis on combating antimicrobial resistance. Beyond, of course, policies and strategies, the whole discussion we're having today is about rethinking and, of course, transforming the way we produce food, how we consume it, and, of course, how we value it. It's about making the healthier and, of course, more sustainable choice, not being a luxury, but the default choice for our citizens. So at the production level, we are working closely with our farmers and our producers. We're encouraging them for more sustainable agriculture and livestock practices, including, of course, the sustainable and rational use of plant protection products, while at the same time trying to reduce overall reliance on chemical inputs and antibiotics, and of course strengthening local and seasonal production. In this context, we place particular emphasis on integrated pest management practices, which we regard as a key tool to reduce chemical inputs while at the same time safeguarding productivity and sustainability. So at the same time, in Cyprus, we're taking steps to reduce greenhouse emissions, gas emissions, which are linked to food production, and of course to protect our natural resources. one area which is of a real challenge to Cyprus, it's been discussed before, and a real challenge is food waste, unfortunately, which is not only an environmental issue, which indeed it is, but at the same time, it is a moral issue. We are making efforts for businesses to be informed and food operators to have in mind of the significance of food waste reduction. And we are making efforts to guide them on how to donate and redistribute food surpluses without, of course, at the same time compromising food safety. Cyprus is among countries with the highest life expectancy in the European Union. However, we are increasingly confronted with diet-related challenges. We are facing increasing trends in adult and childhood obesity, another issue that was brought up before. We are investing in our youngest citizens through schools, being a key setting where lifelong habits are formed. So we are attempting through targeted programs to monitor children's growth, promote healthy eating, and provide guidance not only to students, but of course at the same time to their families. School canteens are regulated to reflect the principles of what we call the Mediterranean diet, while limiting foods that are high in sugar, salt, and of course unhealthy fats. So going to health perspective, of course nutrition plays a central role in preventing disease. Cyprus in 2019 has implemented a universal healthcare system where we place strong emphasis on primary care, which is very important. We are investing a lot in primary care. And of course, increasingly, nutrition is becoming part of everyday medical practice, that something that did not exist in the past. Personal doctors serving as gatekeepers of the system can refer patients to dietitians today, helping to manage conditions such as obesity, diabetes, and cardiovascular diseases. Of course, at the same time, we are implementing national policies on cardiovascular diseases, diabetes, improving the quality of population through healthy diet and physical activity, and healthy aging at the same time prioritizing the prevention and lifestyle interventions as core pillars. So this multi-dimensional approach to sustainable food systems clearly illustrates that why the One Health approach is so essential. It reminds us that human health, animal health, and of course the environmental health are not separate challenges. They are interconnected. They are dimensions of the same underlying reality. Whether we're tackling antimicrobial resistance, ensuring food safety, or promoting sustainable food systems, effective collaboration across all sectors is indispensable. This is why strong governments and multi-sectoral decision-making are essential for making well-informed decisions and effective, of course, interventions in this complex system. Cyprus remains committed to working with international partners to tackle these shared challenges. Thank you very much for your attention. Thank you very much.
Thank you so much for bringing the important angle of food waste. In many places, we produce a lot, and we also waste a lot. I think part of the solution should come from reducing the food waste. And in some commodities, we even lose shameful amounts of food. I think that's really important. We've noted your focus on families and farmers and the environment. That's really clear. And congratulations for being the country in EU with the highest life expectancy. It means that your people are happy. Thanks for your leadership. You also talked about what we can do now. What is it that we are trying to leave for future generation? Very, very important. You talk about the choices. It's about giving people the choices, not processed, not ultra-processed food, but options that can reduce the obesity. And finally, touching on reducing greenhouse gases in the food system is an important area. We need to learn from each other, and that's also a very sensitive thing that we should use a system approach to address. Ladies and gentlemen, we've heard from public policies from 3 distinct countries, and then you can see the overlaps. We've been exposed to experiences that have taken place and actions in those countries and how we can generalize. So thank you, Minister Kwabena, Minister D, Minister Neophytus, for sharing perspectives from your countries and for the leadership that you've demonstrated in addressing us here today. So we thank you so much. We may join back your seat. Thank you. Can we start this side here? Thank you so much. Wonderful. Yes. Thank you so much. Yeah. In the food system, transformation or resilience effort, there are multiple actors. We are going to have the next panel with some entities and individuals and leaders who are actually taking actions. Let me invite them on stage. I will start with Dr. Trevor from IUCN. Please come on stage. You can use the left side too. Dr. Barbara Dufour. From VSF International. Let me invite Mr. Robert Klaban from Olmix. Our next panelist, Mr. Babafemi Oyewole, representing the Pan-African Farmers Organization. Last but not least, Louison Lanson, co-founder of Let's Food. We have in front of us a very diverse panel, which is an opportunity to hear the different views of some of the actions that are taking place. I would like to start with Barbara, VSF, to really help us understand your experience showing linkages between animal and human health and what it can deliver in the integrated One Health approach that we are looking for. Over to you. Is it not working? Yeah. It's working. Yeah, just use it. Yeah.
Merci beaucoup. Merci pour cette invitation. Je vais m'exprimer ici au nom de Vétérinaires sans frontières internationales, qui est un réseau d'ONG. Et je suis moi-même présidente d'une de ces ONG, la plus importante dans le réseau, Agronomes et Vétérinaires sans frontières. Et vous voyez que déjà, la nomination, le nom même de notre ONG, c'est déjà du One Health, en fait, puisque nous avons décidé de nous réunir, agronomes et vétérinaires, pour pouvoir aider ensemble et faire ensemble du développement auprès des populations les plus défavorisées d'Afrique, d'Asie et d'Amérique latine, et notamment pour aider les agriculteurs, les paysans, à produire durablement et à produire et à vivre dignement de leur production. Alors, on m'a demandé d'illustrer de manière concrète, parce que depuis 2 jours, on parle beaucoup du One Health au plan des collaborations nationales, internationales, qui sont essentielles et très importantes. Moi, je vais apporter ici un témoignage véritablement de terrain, c'est-à-dire comment sur le terrain on peut réellement faire du One Health et pourquoi il est essentiel d'en faire. Parmi les 80 projets programmes conduits sur le terrain par VSF International, c'est difficile de choisir lesquels vous présenter, dans la mesure où pratiquement tous sont orientés de manière intégrée entre des agronomes, des vétérinaires, mais également aussi des collègues qui s'occupent de l'environnement. Et parce que nous promouvons d'abord et avant tout auprès de ces paysans l'agroécologie. Donc l'agroécologie, c'est évidemment, obligatoirement, quelque chose qui intègre différentes disciplines et qui est absolument nécessaire si on veut produire durablement. Alors bon, j'ai choisi finalement de vous parler d'une ou deux expériences plus concrètes de terrain. La première expérience, c'est une expérience d'aide à la constitution, à la création de personnes qui, sur le terrain, vont apporter un appui à la santé animale. Dans l'agroécologie, l'élevage et l'agriculture sont indissociables. L'agriculture produit pour nourrir des gens, mais les sous-produits agricoles servent à nourrir les animaux. Les animaux apportent de la fumure, ils apportent également de la traction animale, ils apportent évidemment de l'alimentation aussi, et leurs interactions sont assez indissociables. Et donc, si on veut demain pouvoir promouvoir une agroécologie, il faut pouvoir promouvoir également un élevage digne de ce nom, c'est-à-dire un élevage qui n'est pas affecté, ça a été dit précédemment par le ministre du Cambodge, par des grandes maladies, par des grandes épizooties. Ça veut dire également promouvoir, pour pouvoir éviter ces maladies, il est nécessaire de promouvoir des techniques d'élevage, des techniques d'alimentation de ces animaux les meilleures possibles, avec les ressources locales bien évidemment. Et pour tout ça, il est essentiel d'avoir une santé de proximité, c'est-à-dire d'avoir des agents de santé de proximité. Il y a bien sûr des vétérinaires dans la plupart des pays du Sud, mais ils sont trop peu nombreux et trop peu proches des agriculteurs. Et dans beaucoup de pays, alors je pourrais citer le Togo, Madagascar, la Côte d'Ivoire, le Sénégal, je pourrais citer comme ça toute une autre série, le Cambodge aussi, évidemment, toute une autre série de pays. Nous avons, nous, Vétérinaires sans frontières internationales, d'abord à VSF, c'est nous qui avons créé ça, mais ensuite a été repris par la plupart de nos collègues des autres ONG. Nous avons aidé des communautés à choisir des éleveurs parmi les gens de leur communauté. Et nous avons proposé à ces éleveurs une formation qui leur permet d'être infirmiers, non seulement de leur élevage, mais des élevages de leur communauté. Infirmiers, mais aussi aide à la production, c'est-à-dire que non seulement ils apportent des techniques de soins, non seulement ils aident à rationaliser l'emploi des médicaments, mais également ils aident à améliorer auprès des éleveurs les techniques d'élevage, les techniques d'alimentation, les techniques de bâtiment, comment préserver les animaux en bonne santé pour éviter les maladies en fait. Ces AXA, comme on les appelle, ou APSA dans certains pays, auxiliaires communautaires de santé animale, évidemment, nous les avons portés, nous les avons aidés avec leur communauté locale, mais également avec les vétérinaires de proximité, de manière à ce qu'ils puissent continuer à se former, d'une part, et puis surtout être en lien pour les médicaments avec ces vétérinaires de proximité. Et tout ceci, bien évidemment, avec les services vétérinaires nationaux. Ces expériences locales, il faut évidemment ce qu'on appelle, nous, dans notre jargon d'ONG, les passer à l'échelle. Et nous avons réussi ces passages à l'échelle en discutant avec les services vétérinaires, avec les services de santé aussi de différents pays. Nous avons réussi à les passer à l'échelle dans plusieurs pays. Je pourrais citer le Togo, je pourrais citer le Cambodge et puis récemment Madagascar. Je voudrais ajouter aussi qu'à Madagascar, nous avons ajouté une formation One Health à ces formations d'AXA. Et nous avons réussi également, en discutant avec l'Organisation mondiale de la santé animale, l'OMSA, que vous connaissez forcément tous, à faire reconnaître ces AXA comme des éléments absolument indispensables de la santé de proximité. Non seulement indispensable à la santé des animaux et des éleveurs et des agro-éleveurs des pays du Sud, mais également indispensable à la surveillance épidémiologique, à la détection des premiers foyers, c'est eux qui sont au plus proche des animaux et qui, en lien avec les vétérinaires et avec les services vétérinaires, peuvent signaler l'apparition des premiers foyers et le début de quelque chose qui pourrait devenir une panzootie comme on l'a connu pour le Covid. Ça, c'était le premier exemple que je voulais citer. Je voudrais juste rajouter qu'on a même été plus loin, au Mali, avec une ONG médicale qui s'appelle Odessa. On a réussi à faire des caravanes mixtes de santé, des caravanes qui comprenaient un AXA, donc un éleveur formé à la santé animale, et également un infirmier pour se déplacer parmi les populations nomades et leur apporter une santé à proximité, d'eux-mêmes, à proximité véritablement de ces éleveurs nomades du Nord Mali. Malheureusement, pour des raisons politiques que vous n'ignorez pas, ce programme a été interrompu il y a maintenant quelques mois. Et c'est véritablement regrettable parce que c'était un exemple magnifique d'exercice One Health concret sur le terrain. Un dernier mot sur le pastoralisme, et puis j'en aurai non pas fini, parce que je pourrais répondre évidemment à des questions, mais je voudrais dire également qu'il y a 200 000, vous le savez sûrement, 200 millions de personnes qui vivent du pastoralisme, et donc d'une certaine forme de nomadisme, et c'est essentiel, il valorise des territoires qui ne seraient sans ça absolument pas valorisés par l'agriculture, et eux le valorisent avec des animaux. Donc ces pasteurs ont quelquefois du mal à vivre avec les agriculteurs dans certaines zones, et notamment dans les pays sahéliens, et nous avons organisé localement la discussion avec entre les pasteurs, les agriculteurs et les éleveurs pour l'accès à l'eau, le respect de chacun également, le respect de couloirs de migration des animaux, mais par ailleurs le respect des cultures aussi localement, et puis des échanges également entre de la fumure apportée par les animaux et puis des cultures, des résidus de culture qui peuvent être utiles dans certaines périodes particulièrement difficiles pour les pasteurs. Voilà, je pourrais vous citer des tas d'autres exemples, je pourrais vous parler d'agroécologie en élevage et comment dans la plupart, par exemple au Cambodge, nous avons appuyé des communautés d'éleveurs qui produisent du riz à utiliser les résidus de ce riz pour produire des porcs familiaux, pour nourrir également des volailles. Je pourrais vous parler également comment nous aidons les pasteurs et les agriculteurs du Sénégal et d'autres pays pour diminuer les intrants en limitant l'utilisation des pesticides. Je pourrais parler de tout ça, je pourrais parler aussi des filières équitables qui sont aussi notre lot quotidien parce que quand les gens produisent, il faut qu'ils puissent vivre de leur production, mais je vais devoir m'arrêter là et je le regrette.
Merci bien. Perspective du terrain extrêmement importante. Merci pour ces exemples dans les pays spécifiques. Let me turn to Robert Olmix. You've managed to create a profitable business around alternative to inputs. Can you please share your experience in Asia or Southeast Asia on how you've done that and how we could learn from it and take that to other parts of the world? Thank you.
Yes, thank you. I don't think many of you know Olmix, so I will give you a brief explanation of who we are. Olmix, created 30 years ago, is a company that uses the intelligence of nature to create innovative solutions to change the way that farming is done. The idea being that we need to reduce synthetic entrants into farming, so reduced fertilizers or synthetic fertilizers or other chemicals to produce otherwise. So today we use seaweed, we use wood extracts, we use yeast extracts to create innovative solutions that can help change the way we do farming. We sell roughly in 100 countries, 850 people around the world. But the concrete solutions that we bring, I can give 2 examples. One is using our solutions, we can reduce the use of fertilizer. We could say about durian fruit, or we could say about potatoes, where using our products, we can reduce by more than 30% the use of NPK fertilizers and still have the same production. Which means when we protect the soils, and we haven't spoken a lot about soils today, but it's the first asset of any farmer, is the soil. So if we can protect the soil, if we can improve the soil usage and use less entrants, we'll be regaining something on what we're going to be leaving to our future generations. And the same can be done within the animal care world. One of our solutions that we could use in sows during the maternity and then lactation, it can improve colostrum. It can improve the piglet's weights, but also reduce by more than 34% the use of antibiotics or other veterinary services. So these are concrete solutions, but at the end of the day, it has to have a strong ROI for the farmer. If when he spends €1, €2 on one of our products, if he doesn't get back 2.5, 3 or 4 euros, it will never work. So yes, we have created a company that is profitable and sustainable, because that's the use of any company, but also making sure that the farmers or all the users at the end of the day, they have the same sustainability by changing the way. So we come back to the holistic approach of farming. We come back to the way that we can change the way that farming is done today. And I think what's essential and one of the key messages is that we have the solutions today. They exist. And that is something where the ministers that were here or others, I think it's essential that we talk about the solutions that we can bring to the field today to make a change towards One Health, and not just about the difficulties, because they exist. And we need the help of all the people that were here and spoke earlier today to make sure that it becomes a reality on the ground.
You agree with me that we struggle if you cannot create incentives or a business model around some of these innovations. They're not going to go anywhere. Thank you for that example, and we hope that we could expand this to other parts of One Health. Environmental health, plant health, human health, animal health, and create those incentives for some of those solutions to be scaled, as Barbara has mentioned. So let me now turn to IUCN. Trevor, IUCN, you've worked a lot on the Mekong Valley, using right system to ensure that you could reduce pesticide use and also maintain biodiversity, which is really the DNA of your organization. Can you please very briefly share some examples? Briefly.
Yes, thank you, and good morning to everybody. Like others, I'd like to express IUCN's appreciation for the invitation to be here, but in particular for the long-standing cooperation between France and IUCN, grounded in our shared values, science-based policy, and a strong commitment to multilateralism. But this partnership, and I introduce it this way, has been instrumental in really growing and scaling up our work on food and agricultural systems, and advancing some of these integrated approaches that you're talking about. And I'm privileged to be in a position where I need to coordinate across different sectors for One Health. So just touching on this work in the Mekong, which is really intriguing, and I had the opportunity to go there to see this. The problem that we're hearing about today is that intensive agriculture, though necessary, definitely contributes to biodiversity loss, pollution, and land degradation. Yet, we're also hearing that biodiversity and ecosystem services are absolutely the foundation of food, soil fertility, pollination services, water and climate regulation. So we've got a situation of mutual dependence here, food security and nutritional security are enhanced when agricultural practices lead to improved food density. So the right environment is going to produce better food, better quality food, and better nutrition. So there's a transition needed away from unsustainable practices to more regenerative practices, and based on agroecological principles, as we've heard about. So it's almost, what I found interesting, Chair, is that we're hearing the same pattern of imperatives coming through the room. We need to expand producers' knowledge and capacity. We need science-based public policies, legal and regulatory frameworks. We need appropriate economic and financial incentives and landscape-level partnerships between governments, farmers, businesses, financial institutions, and civil society. So in the Mekong, this is a place where we've tried to discover this with some success. So the Mekong Delta is a major rice-producing region and has suffered from the degrading intensive practices. In particular, the introduction of a third or triple rice cropping regime, which has had severe negative environmental impacts, including on soil and biodiversity, water resources, flood resilience, risks, land subsidence, collapsing fisheries capture in the delta, and excessive pesticides. So here you've got a cocktail of all of the problems. But the solution is also there, hidden, if you like, in the problems. And that's why I like the solution orientation we've been hearing about. What we've been doing, and alongside other organizations, is to support the rice-growing cooperatives to de-intensify rice production and transition towards flood-based agriculture, which is what they used to do. So this is the regime that from antiquity farmers have done. Use the nature-based approach, the nature-based solution, which is rooted in their own knowledge and traditions and culture, and to bring it to the present day and say, look, it's still relevant, this is how you can do it. So during 2020 and 2021 flood seasons, this old tradition of cultivating floating rice was tested by 26 farmers. Sounds a few people, but in a very small and defined area. But the results were really astonishing. The rice that was harvested, along with the integrated aquaculture that goes on below these floating platforms, really increased the revenues markedly. The input costs were significantly lower, there was fewer pesticides being used, and the total profit per hectare increased in that flood season. So this form of floating rice production is quite suited to this modified delta landscape because dikes were built to allow for this third rice crop. The same infrastructure that was damaging the environment can now be used to retain water, allow for the floating rice production, and allow time for these rather more nutritious varieties of rice to be produced. Farmers also piloted other and additional enterprises like farming lotus plants, which can be grown in a variety of these farming environments. And they can be used for not only consumption, but traditional medicine, for fiber. So we see a kind of, if you like, a win-win-win, mutually beneficial set of outcomes where reduced use of fertilizers and pesticides while increasing productivity and farmer income, lower production costs, improved water quality, preservation of the ecosystem for migratory species, for fish and other aquatic animals and plants, and resilience to flooding. So in a way, this also brings together another really important emergent property, that this aligned conservation goals with government priorities around climate resilience, rural livelihoods, and agricultural productivity. So if one can find that sweet spot where outcomes are possible in more than one dimension, this is a real winner. And what this has helped to do institutionally is to bring together this newly merged Ministry of Agriculture and Environment, plus research institutes, development partners, to support further experimentation and institutionalization of these new methods. So, Chair, I'd sort of offer that as as a practical example of what can be done. And the point that follows, though, is that one can't just leave this as a very interesting demonstration. One's got to take it up. And so we're working in IUCN to develop a more global diagnostic approach, which we're calling the a land health monitoring framework, to monitor not only, as we heard, these different dimensions, the productivity element, the livelihoods element, the biodiversity element, the nutrition and food security element, to better understand the linkages and to better exploit where are the bottlenecks, where are the solutions that can be applied. So that's the commitment that we are very happy to bring to the summit, that IUCN will continue working with our members, with our partners, with our framework partners to continually explore and develop the solutions that are actually right there before our eyes. We just have to recognize them and apply them. Thank you.
Thanks a lot. You've built a blueprint in the Delta, Mekong Delta. Secondly, it's about transition to regenerative practices. And I think those are very, very important points to take, because we cannot change the system. You have to transition. Sometimes keeping in mind some of the social elements. So let me go to Pan-African Farmers Organization. Please, I'm pleading to be brief so that we can keep a bit more time for coffee, and we don't want to move into the next session. Thank you so much. Over to you.
Thank you very much, Prof. Good morning, everybody.
Good morning.
I represent the Pan-African Farmers Organization, which is the voice of African farmers. And I bring the apologies of our president, who was supposed to be here, but due to some last-minute issues, he could not be here. PAFO is a continental network of farmers organizations in Africa, representing over 80 million farmers in 5 regions and in 54 countries, with also 80 national farmers organizations. And the mission of PAFO is to empower African farmers through sustainable practices, collaborative innovations, and inclusive representation, transforming food system for a resilient and thriving continent. Today, we are gathering here talking about One Health, which is a very powerful framework and also very urgent. And as has been said by the speakers, it's a concept that reminds us of a simple but profound truth, that is, the health of people, animals, plants, and environment is one and indivisible. But let me be clear, One Health will not succeed in Africa unless farmers are placed at its center. Because every day we see that they are the first to observe emerging animal diseases, because it belongs to them, the custodians of our soils, and also water and biodiversity, and the gatekeepers of food that reaches every household. Therefore, if we are serious about preventing pandemics, combating antimicrobial resistance, and ensuring food safety, then we must invest in those who stand at the very beginning of the chain, the farmers. Farmers are already contributing to One Health by monitoring livestock and reporting disease outbreaks. Our members, they are actually using technology now to monitor their animals, and also working with veterinary doctors to ensure that diseases are detected early enough before it spreads, and they are constantly vaccinating their livestock. And also, our members are also adopting agroecological and climate smart practices and conservative agricultural practices that we preserve the health of the soil and also ensure that nutritious food produce. And also we are reducing the use of agrochemical and antibiotics by investing in biogas technology to produce and use organic fertilizers. And we are also preserving the biodiversity through indigenous knowledge management. Most of the things that are happening, they are not new. They have been there over the years, but we need to really make our members to understand that these practices has been there, agroecology and conservative agriculture, rotating crop rotation, they have been there before. So we need just to bring them down out and apply technology to make it more efficient. So we have been trying to ensure, and the Commissioner for Agriculture in Africa, make mention of the examples in Rwanda, in Ethiopia, that we have been supporting to ensure that farmers contribute to the One Earth framework, so that we'll be able to contribute and ensure that our members are capacitated to do it. Thank you.
Thank you so much. It's really about empowering farmers. Thanks for what you made clear. Without farmers, these interventions will not be effective. Even if they are, they will not be sustainable. Thank you so much. Louison, please chime in, keeping in mind that we have very short time. But really, this is bringing the local perspective. Your association is playing an important role. What can you share from local community, from an association? It is about what's happening on the ground, facing the reality. Please share your perspective.
Merci. Et merci déjà au ministère des Affaires étrangères et au ministère de l'Agriculture de donner la place aux collectivités locales dans cette discussion importante sur les systèmes alimentaires. Donc modestement, je vais essayer de porter la voix des collectivités locales. Donc notre association Let's Food, en effet, accompagne les collectivités territoriales dans les démarches d'amélioration de la durabilité et résilience des systèmes alimentaires en France, mais aussi dans le monde. Pourquoi est-ce que les collectivités locales jouent un rôle central finalement dans la transformation de ces systèmes alimentaires? Donc nous, on a identifié trois grandes raisons, mais j'espère qu'elles sont évidentes pour toutes et tous. C'est déjà une connaissance assez fine de leur territoire, contrairement à un échelon national. Ici, on va être vraiment dans l'adaptation de politiques publiques à l'échelle très locale, une connaissance des enjeux, connaissance des acteurs. Ensuite, parce qu'elle dispose d'un poids aussi croissant. On a aujourd'hui des villes, des collectivités locales qui ont un nombre d'habitants parfois supérieur à certains pays. Et elles ont des capacités d'action assez concrètes, donc des compétences qu'elles peuvent mobiliser sur une variété de sujets à l'échelle locale, qui permet aussi d'avoir cette approche transversale qu'on essaye de promouvoir. Donc en pratique, ces politiques alimentaires territoriales sont donc des stratégies intégrées, transversales, qui peuvent, comme je l'indiquais, s'appuyer sur plusieurs leviers. Elles peuvent mobiliser des leviers de développement économique, des leviers liés à la restauration collective, la commande publique, l'action sociale, la santé publique, l'aménagement du territoire, l'environnement, l'eau, les déchets. Donc on est vraiment sur cette approche à un échelon local, au sein d'une municipalité, transversale à différents sujets. Et donc c'est un exemple assez frappant, je trouve, cet échelon-là, de la mise en œuvre de cette approche santé globale qu'on essaye de promouvoir. Le point déterminant de ces politiques alimentaires territoriales, c'est leur caractère participatif, donc l'importance de cette co-construction de ces politiques alimentaires. Elles s'inscrivent clairement à contre-courant de nos systèmes alimentaires aujourd'hui qui sont plutôt régis par des acteurs privés. Je pense notamment à la grande distribution, à des acteurs qui aujourd'hui, clairement, façonnent la manière dont on s'alimente. Donc ces politiques alimentaires locales, portées par des acteurs publics à l'échelon local, vont être co-construites souvent avec la société civile, avec ces acteurs privés, quand ils sont disponibles pour y participer. Et donc cette participation, bien évidemment, est essentielle et elle a montré ses preuves, puisqu'elle permet justement de s'adapter aux besoins réels, elle permet de faciliter l'appropriation de ces politiques par les acteurs locaux par la suite, et la pérennité de ces actions. En termes d'impact, puisque c'est un peu l'objet de ce panel, sur les solutions qui peuvent être mises en œuvre, on observe des effets très concrets à l'échelle locale. Si je peux donner un exemple, on a même parfois des dynamiques locales qui peuvent influencer des politiques nationales ensuite. Donc là, un exemple qui est assez connu, c'est celui de Belo Horizonte au Brésil. Donc Belo Horizonte, dans les années 90, à la sortie de la dictature brésilienne, la ville de Belo Horizonte met en place une politique assez ambitieuse qui est fondée sur la reconnaissance de l'accès à l'alimentation comme un droit. Concrètement, ça s'est traduit par des actions concrètes, assez ambitieuses, par exemple de création de restaurants populaires qui proposaient des repas équilibrés à bas coût, développement de marchés qui permettaient la vente directe entre des producteurs, des consommateurs, l'orientation de la commande publique vers des petites exploitations qui produisaient de manière responsable. Donc par ce biais-là et par ce pouvoir d'action locale, la collectivité a réussi à réduire les niveaux d'insécurité alimentaire à l'échelle de sa ville. Et cette expérience locale a contribué à nourrir la stratégie nationale brésilienne Fome Zéro, qu'on connaît, qui a été mise en place par le président Lula, qui illustre la capacité vraiment des collectivités à jouer un rôle de précurseur et de démonstrateur à l'échelle locale pour ensuite influencer des politiques nationales. J'aimerais aussi peut-être simplement mettre en avant le fait que certaines collectivités s'engagent aussi au-delà, on va dire, de leur périmètre administratif, à l'international, l'importance de ce partage d'expériences vers d'autres collectivités en dehors de son territoire, en dehors de son pays, pour justement enrichir les pratiques d'autres. Et je prendrai notamment l'exemple du département des Hauts-de-Seine en France qui collabore depuis 2010 avec la province de Siem Reap au Cambodge, donc nos collègues sont encore ici, depuis 2010 sur une politique alimentaire territoriale ambitieuse. Donc ça a permis, ces échanges-là, de faire initier une politique alimentaire territoriale pour le département des Hauts-de-Seine, mais aussi en parallèle pour la province de Siem Reap. Donc un intérêt aussi à penser en dehors de ces limites administratives à l'échelle extra-locale, donc, puisque ces sujets alimentaires ne s'arrêtent pas à nos frontières. Merci.
Merci bien. Nous avons noté la dynamique locale qui peut influencer la politique nationale et même globale. Nous avons aussi noté les activités locales qui assurent la pérennité de certaines innovations et des interventions. Merci beaucoup. As we wrap up this session, let me apologize for the time that has gone. We could highlight some of the things, but I think the session has been very, very rich. Any one of you, you've noted the collaboration, you've noted connection to policymaker, and also noted sustainable practices. I stand in front of you here representing the CGIR. We support everything we've heard here. We are the largest global agricultural research systems in the world, about more than 10,000 scientists. And we want to make some commitments here today. We have used the integrated approach for animal and aquatic food system to ensure that we transform our food systems. And our commitment is to launch 10 operationalizing areas for One Health globally by 2030. Secondly, our portfolio will increasingly be taking into account the One Health approach, whether it is at the International Livestock Research Institute, International Potato Center in Peru, or Summit in Mexico. That's what we are going to do to ensure that it's about people, animal, the environment, the food systems. Number three, we have signed an agreement with the World Organization of Animal Health to ensure that the One Health is not just a concept, that we can drive practical approaches, including capacity building, training, supporting policies at the country level. And finally, we've talked about nutrition. We have just jointly the International Livestock Research Institute with Community Jamil, they're here in the room, using artificial intelligence to really establish a forecasting systems for malnutrition. And we want to do this keeping in mind people who live in pastoral areas, the most vulnerable on earth. So those are the 4 commitments that we are making to ensure that the leadership that we've seen here between France and Ghana and all the technical implementation and the experiences and lessons learned from the countries will be the building block for us, as I say, to be good custodians of our planet. On this, let me thank the panelists and thank the audience for sticking in there. And thank you so much for the great conversation that we've had this morning. Thank you so much. Okay. Well done. Thank you. Sorry to have rushed.
No, it's fine.